Have you ever walked into a room and completely forgotten why? Or maybe you misplaced your glasses, only to find them sitting right on your head. Now, imagine if this wasn't just normal forgetfulness, but something quietly linked to the very pills you take every day. That's right, many common medications, even ones prescribed for years, can subtly affect memory and focus, especially after age 60. But don't worry, in today's video, we're not here to scare you, we're here to empower you. By the end of this video, you'll understand which medications might influence memory and what gentle natural steps you can take to protect your brain health. Before we begin, if you care about keeping your mind sharp, body strong, and heart happy after 60, make sure you subscribe to Golden Years Health and Wellness. We share easy, science-based tips for living your healthiest, happiest senior life without confusion or fear. All right, let's get started. Our brains are amazing. They hold our stories, laughter, lessons, and memories that make us who we are. But as we age, small changes in brain chemistry, blood flow, and medication use can make memory lapses more common. Now, let's be clear, never stop or change any medicine without talking to your doctor. The goal of this video is simply awareness, to help you start a conversation with your healthcare provider if something doesn't feel right. Sometimes, it's not aging that is causing forgetfulness. It is a side effect we didn't know to look for. So today, we'll explore 9 common medications that research suggests may affect memory or mental clarity, and what you can do instead. Let's start with something many of us take for allergies or sleep: antihistamines. These include popular brands for sneezing, runny noses, or even over-the-counter sleep aids. Some older versions of these medications, especially those containing diphenhydramine, like Benadryl or chlorpheniramine, are known as anticholinergic drugs. What does that mean? Simply put, they block a brain chemical called acetylcholine, which is essential for memory, learning, and attention. When acetylcholine levels drop, your brain's ability to process and store information can slow down, almost like a computer running too many background programs. Mini story. Let's imagine Mary, a 67-year-old grandmother who loves gardening. She started taking an over-the-counter allergy pill every night to help her sleep better. After a few months, she noticed she couldn't recall where she placed her keys or whether she dewatered her plants. At first, she thought, oh, it's just aging. But when her doctor reviewed her medications, they found that her nightly allergy pill was the culprit. Once she switched to a newer, non-sedating antihistamine like cetirizine or loratadine, her memory improved noticeably. Takeaway: if you take something for allergies or sleep, check the label. Look for ingredients like diphenhydramine or chlorpheniramine, and ask your doctor about safer alternatives. Now, let's talk about another common group: sleep and anxiety medications, such as diazepam, Valium, lorazepam, Ativan, and alprazolam, Xanax. These are often prescribed for anxiety, stress, or insomnia, and they can be very effective in the short term. But here's the catch: long-term use can interfere with how your brain forms new memories. These medications work by calming the brain. They slow down electrical activity to help you relax or sleep. But when used frequently, especially in seniors, they can also slow memory encoding, the process that helps you store new information. Mini story. Let's take Tom, a retired teacher in his 70s. Tom began taking a small dose of sleep medication each night. At first, it helped. He fell asleep faster and felt more rested. But after several months, he noticed he was repeating stories and misplacing his wallet more often. When he visited his doctor, he learned that his medication was affecting his short-term memory. Together, they developed a plan to reduce his dosage gradually and replace it with gentle, natural sleep routines, like turning off screens 1 hour before bed, having chamomile tea, and meditating for 10 minutes. Within weeks, Tom's sleep improved, and his mind felt clearer. Takeaway: if you've been using sleep or anxiety meds for a long time, talk to your doctor. There are often safer, non-medication strategies that protect both your rest and your memory. Next on our list are medications many people take for heartburn, acid reflux, or stomach ulcers. You might recognize names like omeprazole, Prilosec, esomeprazole, Nexium, pantoprazole, or ranitidine. These belong to a group called proton pump inhibitors, PPIs, and H2 blockers. They work by reducing acid in your stomach, which can be very helpful if you have GERD or chronic indigestion. But when taken for long periods, some studies suggest they may slightly increase the risk of memory problems or cognitive decline. Why? Scientists believe it's because your body needs stomach acid to absorb key nutrients like vitamin B12 and magnesium, both crucial for brain function. When those nutrients drop too low, your brain doesn't get the fuel it needs to think clearly. Mini story. Take Linda, a 72-year-old who took acid reflux medication every morning for nearly 5 years. She started to feel more tired, sometimes confused, and even forgot names of her favorite neighbors. Her doctor discovered her vitamin B12 levels were very low, likely from her daily medication. After adding a B12 supplement and slowly tapering her dosage, Linda's memory improved noticeably. Takeaway: if you've been on acid reflux medicine for more than a few months, ask your doctor about periodic vitamin B12 and magnesium checks. Whether a lower dose or on-off schedule might work. Natural aids, like eating smaller meals, avoiding late-night snacks, and elevating your pillow during sleep. Now, this next one surprises many people. Bladder control medications, often used for overactive bladder or frequent urination. These include oxybutynin, ditropan, tolterodine Detrol, and solifenacin, Vesicare. They help by relaxing the bladder muscles, but they also work by blocking acetylcholine, the same brain chemical that antihistamines affect. That means long-term use may contribute to brain fog, slower thinking, or memory loss. Mini story: Eleanor, age 75, found herself needing the bathroom too often at night. Her doctor prescribed a bladder relaxant, and at first, it worked beautifully. But after about 6 months, she noticed she couldn't recall simple things, like where she placed her purse or what day her grandson was visiting. Her physician explained that her medication could be interfering with her memory. They decided to try a pelvic floor exercise routine and reduce caffeine, and within a few weeks, her bladder symptoms and mental clarity both improved. Takeaway: if you're on a bladder medication, ask your doctor whether there's a non-anticholinergic alternative, or try natural strategies like pelvic floor Kegel exercises, avoiding caffeine and alcohol before bed. Maintaining a healthy weight, sometimes small lifestyle shifts make a huge difference. Finally, let's talk about a group. Almost everyone over 60 is familiar with pain relievers and blood pressure medications. 1. Pain relievers. Certain strong pain medications, especially opioids like codeine, oxycodone, or morphine, can dull not just physical pain, but mental sharpness too. These medications can slow brain activity, and affect focus, reaction time, and memory. If used long-term, they can even change how the brain processes reward and motivation. It's mini story. Frank, a 68-year-old retiree, started taking opioid painkillers after back surgery. Months later, he felt emotionally flat and often forgot what he was doing mid-task when his doctor switched him to a gentler non-opioid regimen and introduced daily walking and stretching. He felt more alert and happier than he had in months. 2. Blood pressure medications. Some blood pressure drugs, particularly older beta blockers, like propranolol, can cause tiredness or mild confusion in sensitive individuals. This doesn't mean they're bad, but it does mean if you notice brain fog or fatigue, you should bring it up with your doctor. Takeaway: never stop your medication suddenly, but communicate any new mental or emotional symptoms. Sometimes a tiny dose change or a switch to a newer formula can make all the difference. Now that we've talked about medications, let's end on something positive: what you can do every day to protect your memory. These simple, daily habits have been shown to keep your brain active and resilient. Challenge your mind. Learn a new skill, puzzle, or language. Your brain grows stronger through new experiences. Move every day. Even 20 to 30 minutes of walking improves blood flow to the brain. Eat brain-healthy foods. Include leafy greens, berries, fish, and olive oil. Prioritize sleep. Quality rest clears out toxins from your brain cells. Stay connected. Regular social interaction keeps your memory and mood strong. Stay hydrated. Dehydration can mimic symptoms of memory loss. Remember, medication may affect your memory, but lifestyle protects it. Every small healthy habit adds up. If you found this video helpful, please give it a thumbs up and share it with a friend or loved one who might also be taking some of these medications. And don't forget to subscribe to Golden Years Health and Wellness for weekly videos that help you live longer, move easier, and think sharper naturally and safely. Your memories are treasures: the laughter of your grandchildren, the scent of your favorite meal, the stories of your youth. They deserve to be protected. So, if you take just one thing away from this video, let it be this: you have more control over your brain health than you think. With awareness, communication, and care, your golden years can be filled not with forgetfulness, but with clarity, confidence, and joy. Stay kind to your body. Stay curious with your mind. And as always, keep shining, because your best years are still ahead.